Welcome to NSA 306, the study section 5, application of the nursing process. This study session is the continuation of the previous knowledge you gained in this course. You will learn how to write hypothetical nursing care plan using the information learned from the previous study section. When you will have studied this section, you should be able to define nursing care plan and highlight the guidelines for writing nursing care plan. You should be able to explain the assessment tools for planning care. You should be able to discuss how documenting interaction, observation, and measurement are done and explain implementation of nursing care plan. You should be able to discuss scientific rationale in nursing care plan and explain how evaluation of nursing care plan is done. Nursing care plan. This is the plan of care that a nurse draws out for the individual patient after careful assessing the patient's needs and arranging them in order of priority. The nursing plan begins with the nursing diagnostic statement and progresses to the goal and objective. Once these are identified, unique nursing orders are selected to help the client achieve the goals and objectives. This is the core of nursing management, the independent prescriptive role of writing nursing orders. Nursing care plans are not delegated medical orders or functions, although nurses are still involved in implementing these functions and orders. The nursing orders is separate and is explicitly in a nursing action. Components of nursing care plan. The care plan is divided into 5 parts, namely the nursing diagnosis. This is a brief statement of the patient's response to his actual or potential unhealthy situation that nursing can help change. The statement should be a standardized nursing diagnostic category. An actual diagnosis is written in 3 parts. 1. Category related to contributing factors as manifested by signs and symptoms, while a potential diagnosis can be continually identified depending on the patient's condition. This should be prioritized. Then let's go to objective. Objectives is a statement of what the nursing action to achieve for the patient. It is patient-oriented, measurable, attainable, brief, and time-bound nursing action. This is the actual nursing care that a nurse carries out to meet the objectives of a particular need. It is written as briefly as possible. It should be written in order form. It is a continuous process based on evaluation and reassessment of patient condition. The action can include independent, dependent, and interdependent roles of nurses, rationale or scientific principles. This is the statement of the reasons or scientific basis for the nursing care that the nurse carries out. It should relate to the objective as well as the action. Evaluation. This is the final assessment of the objectives the nurse sets out to achieve, stating either negative or positive outcome. If negative, reassess the problem to cause outcome. You can write as the anticipated outcome. If it is positive, then you can proceed to another line of management for the patient. Guidelines for writing plans for implementation. The following guidelines are suggested for writing plans for implementation. 1. The plan is dated and contains the signature of the responsible nurse. The date is important since the nursing orders are reviewed and updated periodically. The date the plan is written is used as a point of reference for evaluation and future planning. 2. Implementation strategies and nursing orders are appropriate to their respective objectives. A nursing strategy is defined as an overall plan or tactics that serves as a guide for individual nursing orders. Clearly defined objectives provide a sound basis for selecting nursing strategies. Plans are written in terms of clients and nursing behaviors sufficient to achieve goals and objectives. Nursing plans define the types of nurse and client action. In some plans, such as crutch walking, the client takes over the action completely. In other plans, the nurse assumes the dominant role. The nursing plans are stated in specific terms, giving direction to the behavior of the nurse and client. The nursing orders need to be specific. What does the client need to do to achieve the objectives and goal? The plans includes preventive, promotional, and rehabilitative aspects of care. All three aspects of care, prevention, promotion, and rehabilitation, are included in the plans for each client. The client's general state of health, identified health concerns and strengths, and the situation dictates which aspect is the focus. The nursing plan includes collaborating and coordinating activities. Collaboration and coordination are essential components of nursing leadership that are intrinsic to the nursing care plan. With whom do you need to collaborate to assist the client in achieving the objective? The physical therapist, nutritionist, community health nurse, or agency that can supply information, materials, finances, consultation, equipment, or appliances to the client. The plans are placed in an appropriate sequential order based on priority. The nurse needs to establish the sequence of events in order to achieve the objective. What is the most important action to take first? When the objectives have been arranged in order of priority, the nursing orders should follow accordingly. 8. The plans incorporate the autonomy and individuality of the client. The plan is individually tailored to the unique characteristics of the client. Autonomy and individuality can be encouraged by giving the client the choice in setting the times for care as well as in selecting the method to be used. Plans are kept current and revised and include alternate plans when indicated. For a plan to remain current, it must be flexible. The nurse must modify goals and approaches as situation changes. Plans for the client's future are included. The two major concepts in the area of future planning are the termination of the nurse-client relationship and discharge. The nurse-client relationship terminates when the client no longer needs professional nursing care. Assessment tools for planning care. Assessment is essential before making a plan and is made through observation. By observing the patient or client and his immediate environment, some of his needs can be identified. For example, dyspnea, dehydration. Number 2, interview. By discussing with the patient or his relatives, other needs can be identified like insomnia, pain, cough, fear, knowledge deficit. Records. The patient's records provide useful data as to what care has been given and the effect of such care, as well as recorded observations on progress or condition of patient as noted by other healthcare personnel. It also gives the nurse information about the dependent functions of care, for example, pyrexia, bleeding, condition of drainage and wound, vomiting, diarrhea, level of consciousness, others such as bed rest for the patient, tools for data collection. Data collection occurs through the use of three tools: one, interaction, observation, and measurement. Interaction data are considered as any spoken words from the client, healthcare personnel, or significant others. Observations made through the senses, including written documents, are observation data. Measurement data are those obtained from the use of instruments that quantify information. Scientific rationale and evaluating care plan. Knowledge is the basis for prescribing and implementing nursing orders. A scientific rationale describes and explains the basis for nursing orders. For example, consider the scientific rationale relevant to the following questions. Why do we restrict fluid at certain times for clients who have problems of circulatory or excretory system? Why should the nurse assess learning needs before teaching? Why should clients learn to take their pauses before leaving the hospital for home if they will be taking digoxin at home? Why do we encourage clients to cough to loosen breaker secretion if we know that deep breathing will reduce coughing? Why do we avoid arguing with a delusional client? Those are examples. The rationale in each case is based on theories, models, framework, and scientific principle from nursing, the natural and behavioral sciences, and the humanities. The principle, concept, or theory that supports each step of the plan is stated. The rationale for the steps of the plan is usually not written into the nursing orders, but it must be known by the nurse. In some instances, the rationale is written into the plan to ensure effective communication. For example, if a client is asked to change a complicated dressing alone, it will be necessary to include a written rationale. Otherwise, another care provider may do it for the client, not realizing that the client needs to learn how to change the dressing alone. The following guidelines are suggested for writing a scientific rationale. The scientific rationale addresses the identified topic and strategy and the individuals of the client and family. The scientific rationale cites appropriate research findings and current literature. Any reliable writing or persons may be considered appropriate. The resource is cited for each supporting scientific rationale. Now let's go to forms of evaluation. Evaluation may be conceptualized in three forms: structure, process, and outcome. Process and outcome evaluation can both be subdivided into categories: concurrent, that is present, and retrospective, that is past. Each form will be discussed separately. When you get to your study manual, try to learn more about each of these forms of evaluation. Thank you for listening. See you in the next class.